Hello, I'm going to take you through some few questions on penicillin. So the first question is, what is the mechanism of penicillins? So penicillins act by interfering with bacterial wall synthesis, causing weakening and breakdown of the bacterial cell wall. The other question is saying, which types of bacteria are penicillins active against? So penicillin drugs are active against gram-positive organisms and gram-negative cocci. Then the other question is saying, what is the main difference between narrow-spectrum and broad-spectrum penicillin? Narrow-spectrum penicillins are active against gram-positive bacteria with less activity against gram-negative bacteria, while broad-spectrum penicillins are active against most gram-positive and gram-negative bacteria. What is the presentation and indication of benzylpenicillin? What is the presentation and indications of benzylpenicillin? So benzylpenicillin is presented as a vial containing injectable powder and is indicated for tonsillitis, otitis media, streptococcal endocarditis, meningococcal, and pneumococcal meningitis. That is for benzylpenicillin. What is the recommended dose of benzylpenicillin for adults? The recommended dose for adults is 2 to 4 mega units in 4 to 6 divided doses, which is administered through IM or through slow IV infusion. Then the other question is saying, describe the presentation and indications of Procaine penicillin. Describe the presentation and indications of Procaine penicillin. Procaine penicillin is presented as an injection containing benethamine penicillin, Procaine penicillin, and benzyl penicillin sodium. It is indicated for penicillin-sensitive infections. What is the recommended dose of Procaine penicillin? The recommended dose is 75 milligrams to 600 milligrams, which is administered deep intramuscularly once daily. What are the presentation and indication of benzathine penicillin? What are the presentation and indications of benzathine penicillin? Benzathine penicillin is presented as a vial containing injectable powder and is indicated for penicillin-sensitive infections, particularly syphilis and rheumatic fever prophylaxis. What is the recommended dose of benzathine penicillin for adults? What is the recommended dose of benzathine penicillin for adults? The recommended dose for adults is a single dose of 2.4 mega units intramuscularly or 1.2 mega units for rheumatic fever prophylaxis. Describe the presentation and indication of phenoxymethylpenicillin. Phenoxymethylpenicillin is presented as tablets or suspension and is indicated for upper respiratory tract infections, tonsillitis, otitis media, and sinusitis. What is the recommended dose of phenoxymethylpenicillin for adults? What is the recommended dose of phenoxymethylpenicillin for adults? So the recommended dose for adults is 250 to 500 milligrams every 6 hours, at least 30 minutes before food. Okay, the other question is saying describe the presentation and indications of ampicillin. So ampicillin is presented as capsules, suspension, or injectable powder, and is indicated for urinary tract infections, otitis media, chronic bronchitis, and invasive salmonellosis. What is the recommended dose of amoxicillin? What is the recommended dose of amoxicillin? So the recommended dose of amoxicillin is 250 to 500 milligrams every 8 hours, and it is given through the mouth. How do the side effects of amoxicillin compare to those of ampicillin? How do the side effects of amoxicillin compare to those of ampicillin? So the side effects are similar, but diarrhea is less common with amoxicillin. What are the penicillinase resistance penicillin? So the penicillinase resistance penicillins are penicillin drugs designed to resist inactivation by the beta lactamase produced by certain bacteria. Describe the presentation and indication of Cloxacillin. Describe the presentation and indications of Cloxacillin. So Cloxacillin is presented as capsules, suspension, or injectable powder, and is indicated for infections due to the penicillinase producing bacteria. What is the recommended dose of Cloxacillin for adults? What is the recommended dose of Cloxacillin for adults? So the recommended dose for adults is 250 milligrams through the mouth every 6 hours. What routes of administrations are available for Cloxacillin? What routes of administration are available for Cloxacillin? So Cloxacillin can be administered orally, intramuscularly, or intravenously. So given through the mouth, through IM, or through IV. What are the nursing considerations for patients receiving penicillin drugs? So nurses should ask about any allergic reactions to penicillin, obtain specimens for culture and sensitivity tests, ensure patients take the entire quantity of medications as prescribed, and also give with food to prevent GIT distress, and also warn against using leftover medications for new illnesses. Why is it important for patients to complete their entire course of penicillin medication? So, completing the entire course of medication helps ensure the infection is fully treated and reduces the risk of antibiotic resistance. How can penicillin resistance develop? So penicillin resistance can develop through the acquisition of the beta lactamase enzymes that inactivate the antibiotic. Okay, it can also develop due to alterations in the bacterial cell wall. Okay, so those are some of the questions that I had for you on